Hey, are you ready to differentiate bipolar 1, bipolar 2, and cyclothymic disorder? Perfect, because Tiff the therapist is here to make it easy. Keep in mind you can always pop open the DSM-5 TR or the DSM-5 TR made easily, and I highly recommend you do. But for now, it doesn't hurt to engage in some peer learning. So, let's start with bipolar 1 disorder. Imagine it as the big brother of the bipolar family. With bipolar 1, individuals experience manic episodes that last at least 7 days or are so severe that hospitalization is required. These manic episodes are often characterized by intense highs, impulsivity, and sometimes even psychosis. Mania is a significant and distinct period of elevated, expansive, or irritable mood, along with increased energy or activity. A person's behavior changes drastically in distinct period of elevated, expansive, or irritable mood, along with increased energy or activity. In order for a licensed provider to diagnose a person with bipolar 1, the following criteria must be met. Manic episode and three or more additional behaviors must exist. Grandiosity or inflated self-esteem. No, we are not talking about how the greatest rapper of all time, Lil Wayne, thinks he's an alien. 2. Decreased need for sleep. 3. More talkative than usual or pressured speech. 4. Fight of ideas. 5. Distractibility. 6. Increase in goal-orientated activity. 7. Increase in activities that may use in negative consequences, like buying everybody in the bar shots but not actually having money. The mood change must impact the person's function at home, at school, at work, or in social environments. The behavior is not caused by substance use. We may view bipolar 2 as the little brother, but everyone knows you have to keep an eye on the baby. In order to meet the criteria, an individual must experience a hypomanic episode and at least one depressive episode, but they could have never experienced a manic episode. Hypomanic episodes share the same behaviors as manic. The only two differences are the duration, which is at least 4 days, and the behavior does not impair function at school, home, work, or socially. This is why bipolar 2 is a little troublesome, because one may not view these behaviors as a reason to seek a mental professional. Furthermore, during a depressive episode, individuals must experience 5 or more of the following symptoms within a 2-week period, resulting in a change in their level of functioning or a loss of interest in previously enjoyable activities. 1. Persistent feelings of sadness, emptiness, or hopelessness that are noticeable to others. 2. Markedly reduced interest or pleasure in all activities. 3. Significant weight loss or a decrease in appetite without intentional dieting. 4. Insomnia or excessive sleeping nearly every day. 5. Psychomotor agitation or retardation such as restlessness or slowed movements. 6. Fatigue or loss of energy on a daily basis. 7. Feelings of worthlessness or excessive guilt. 8. Difficulty concentrating or making decisions. 9. Recurrent thoughts of death, suicidal ideation, or suicide attempts. Behaviors are not justified by substances or other medical conditions. Lastly, let's look at cyclothymic disorder. As the cousin according to the DSM-5 TR, a mental health provider must have evidence of: for adults, numerous periods of hypomanic symptoms, as well as numerous periods of depressive symptoms that occur over a span of at least 2 years. For children and adolescents, the duration is at least 1 year. During these periods of mood disturbance, the hypomanic symptoms and depressive symptoms do not meet the criteria for a full-blown manic episode or a major depressive episode. The criteria for a major depressive episode may be met if the duration is shorter than the required 2 weeks or 1 week for children and adolescents, but the symptoms are persistent and frequent. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. The duration of the periods with hypomanic symptoms and depressive symptoms has been present for at least half the time during the 2-year or 1 year for children and adolescents period, and there have been no periods of symptom-free intervals lasting longer than 2 months.
Now I think it's the perfect time to go ahead and introduce myself and tell you, if you like this video, go ahead and either like it, subscribe to my channel because I have a ton of new videos coming in. If you guys were with me with my first YouTube channel, you know that I had like the Jeopardies and all that great stuff, but my page was hacked, and so we're starting over from scratch. So make sure that you leave some comments down below to let me know, what you like, what you want to see, how I can help you become a better clinician, how I can help you study down below. In addition, you could share this with other clinicians or other students, or just people that's interested in mental health. So now that we got that out the way, we're going to go ahead and talk a little bit more about how to diagnose bipolar, and some of those type of things. So first thing, the onset of bipolar typically takes place between 15 to 19. And yes, sometimes you can definitely see symptoms in children, but honestly, most of the time, people don't really notice it until later on into adulthood. And that's when individuals usually get service. So, who can diagnose? Quite simple, a mental health professional that is certified, licensed, etc. in diagnosis. Everybody knows there are different licenses and different paths for mental health. So that's really important. So
now let's talk about assessment tools slash measurements. So if someone is showing signs or symptoms of bipolar, then the first tool that may be implemented is the mood disorder questionnaire. It's a 5-minute self-administered assessment tool that looks to see if there are some symptoms that may mimic bipolar. And if this does happen, then that individual will then go to a clinician who has the ability to assess for bipolar. And typically they may use these two measurements because these are very commonly used in their evidence base. So one is known as the Structured Clinical Interview for DSM-5. There are a ton of versions, but we're on the DSM-5 right now, so that's the version that will be implemented. And the acronym for that is SCID-5. And this usually takes anywhere between 45 to 120 minutes, and this is a semi-structured interview assessment tool that does diagnose. The second one will be Schedule for Affect Disorders and Schizophrenia. And the acronym for this one is SADS, SADS. And so this tool actually has a kitty version and is literally called Kitty Schedule for Affect Disorders and Schizophrenia. It just has a K dash in front of the original acronym that I just gave you. This tool is great for individuals between the age of 6 to 18 because remember, bipolar typically onsets at the age of 15. And then last but not least, a tool that may be implemented is a general behavior inventory. And this is not a screening tool for looking for bipolar. This is a measurement tool. So this tool is measuring the severity of symptoms that are associated with bipolar. And then sometimes you may have people that utilize a depression screening to look at.
bipolar disorder is a lifelong diagnosis, and the best treatment may include a combination of medication, psychotherapy, and lifestyle adjustments. So when you think about medication, it would be typically for mood stabilizers. And then when we talk about psychotherapy, the two most common modalities that is implemented is CBT or interpersonal therapy, which was actually created specifically for bipolar. And CBT just definitely helps with helping individuals manage stress, coping skills, and assisting with their sleeping patterns. Because remember, with bipolar, individuals typically lose sleep. And so that's really the gist of bipolar. And if you have any other questions about the diagnosis that we discussed today, which were 3, feel free to go ahead and leave it down below. Now, the next couple of minutes are just going to be for charts. So there are a few charts that I'm going to have just to kind of help you study. If you need to, you can always create your own. But again, this is just to help with peer learning. Again, until next time.